Welcome to Law and Justice. I'm Jane Mulcahy, and today I've the great pleasure of being joined by George Hosking from Wave Trust. Hi, George. How are you?
Hi, I'm great today, Jane, and I hope you are too.
I am very well. Thanks for joining me for this special series of How to Talk Policy and Influence People. I know that influencing policymakers is something that you do with great acumen, but maybe you can tell me, George, a bit about yourself first and your professional background, please.
A very strange professional background. My original degree was in economics. I then became an accountant. I went into industry and I worked for many years in roles in finance and strategic planning, first for a large multinational corporation called Unilever for 17 years, and then running an international strategy consultancy for about 20 years. In the midst of all that, I decided that I wanted to understand people a bit better, and I took a degree in psychology.
Interesting.
And then in the mid-1990s, I became very affected by my strategy consultancy at that time gave 1% of its annual revenue to charity. And one year we were supporting the NSPCC, and I started reading about cases of child abuse. And in reading it, I came across the stories of two children in London who were murdered by their parents. And I read the stories of these two children and came to the conclusion that being murdered was the best thing that ever happened to them.
Goodness.
They had lives of unspeakable torture before their deaths. And I was shocked to the core. I'd imagined that child abuse was parents being a little too heavy-handed, maybe even breaking bones or harming children, but systematic torture over a period of years was just beyond my comprehension. Something snapped in me. And a decision got made, and I've never felt as if I made the decision. It's more like the decision made me, that I couldn't live in a world where things like that happened to children and I did nothing about it. And that's driven my life ever since. My problem was I didn't know what to do. Firstly, I couldn't comprehend why anybody would abuse a child, and I certainly didn't know what to do about it if they did. So I began reading a lot, and in the midst of a lot of reading, the then chair or president of the NSPCC made a speech in 1995 talking about the 50 years since the end of the Second World War. And one of the things that he said was that in those 50 years, levels of child abuse in Britain had not gone down one iota.
It's pretty shocking.
I was kind of shocked by that. When I worked for Unilever, I was an international troubleshooter. I would be sent around the globe to Japan or Africa or South America or various other places and given problems to solve. And I was expected to solve them inside 2 weeks. And if I hadn't solved them inside 2 weeks, I had to leave an action plan that I was confident would solve them. And I pictured myself walking into the doors of Unilever House in Blackfriars, London, and reporting to the board of directors and saying that I'd been tackling a problem for 50 years and made no difference. And I wouldn't have lasted 15 seconds longer in my Unilever career, I guess. Mm-hmm. So I thought to myself, well, I'm a strategy consultant. What would I do if somebody gave me the challenge, end child abuse? So I began to look at it. I discovered that the NSPCC at that time, it's changed since then, along with many other charities, and I looked because Unilever taught me to look globally all over the world, charities and governments all over the world were addressing child abuse by alleviating the symptoms. They were helping abused children, but they weren't getting to grips with the causes of why people abuse children in the first place. I didn't understand why either. Mm-hmm. So I went to university for a third time, and I trained as a clinical criminologist, spent 2 years studying that. I then began working in prisons with violent offenders, almost all of whom I found had been abused or neglected in childhood. And I also discovered that they were almost all suffering from post-traumatic stress disorder. And I wanted to understand that. So after a couple of courses on trauma and PTSD, I went to university for a fourth time. This time I took another 2 years of part-time work, taking an advanced diploma in the management of psychological trauma. It's very Scottish thing to go to lots of educational establishments and always be trying to learn.
Yeah, well, I'm a big fan of it myself, you know, yeah. So keep going. That was your 4th diploma in psychological trauma. Okay.
So in the midst of all this, I set up the charity Wave Trust, which was dedicated to bringing an end to child abuse. In 2005, after 9 years after we were set up, we produced a report called Violence and What to Do About It, because we found violence and child abuse were wrapped up with each other. And this is getting a bit long, so I'll try and be short. That led to me being asked to work with the Metropolitan Police and the Home Office in London and the Scottish Violence Reduction Unit and the Scottish Government, advising them on how to tackle violence in society. And since then, I've worked as an advisor to the 10 Downing Street, the Cabinet Office, the Department for Education, Department for Health, the Welsh Government, and the Northern Ireland Government in various roles to do with early years and prevention or tackling violence or child abuse.
So clearly there's plenty of influencing of policymakers there, I suppose to a greater or lesser degree, because these are, as you said, complex matters. If they weren't, child abuse and neglect and violence would have been solved, one imagines, long ago. What is the 70-30 campaign, George?
The 70-30 campaign is a commitment, but also a strategy to reduce child abuse, neglect, and children witnessing domestic violence by 70% by the year 2030. And that was created because I was finding some years ago that it was much easier to get politicians to agree with what I was saying than to get them to take any action about it. And I resorted to something I used a great deal with great success when I was working in industry, which was to get an organization to commit to a vision which they signed up to, and then to work with them to discuss how the vision could be realized. And I found that when they really engaged with that with interest, they began to come up with solutions quite apart from any solutions I might have had, and then were very successful in implementing those solutions. And for example, I have successfully turned around nearly 30 loss-making international companies in my time in industry, which almost all of those companies had previously spent years trying to improve their cost structures, and that wasn't enough to save them from falling into losses. Mm-hmm. But changing the whole way they thought, changing their mindset, was one of the ways that I succeeded. And usually tackling root causes was fundamental to the success that I had with that. So I thought a method like this, 70-30, setting a goal, getting people signed up to support it, and having a root cause approach into how to implement it might be successful in the social realm. So that was the origin of the 70-30 campaign.
I'm a 70-30 campaign ambassador myself. There are a few of us in the Republic of Ireland, but you've many ordinary men and women across the UK who are campaign ambassadors. Isn't that correct, George?
Yes, we have over 200 people. Some, like yourself, are professionals. Others are simply ordinary individuals who care about the issue. Some are former victims of child abuse or neglect or domestic violence, who don't want to see this continuing in future generations. And at one level, we've had great success. As of today, we have, I think it's 247 members of parliament in the UK Parliament. 347. That's well over half of the UK Parliament. MPs have signed up to back the 70-30 campaign. In the Scottish Parliament, we have over 100 MSPs out of 129 have signed up to support. In the Welsh Assembly, we have, I think, over 90% of, certainly over 80% of Welsh Assembly members signed up to support 70-30. In the London Assembly, we've got over 80%. And in Northern Ireland, until recently, there wasn't an assembly, of course, but in the last Parliament, every single Sinn Féin and DUP MP had signed up to support 70/30, and we also have the support of the SDLP in Northern Ireland. So
that's really great.
It's great at the level of getting support from individuals. What we have not yet been so successful in doing, we've had some successes, but not as much as we'd wish, is getting the legislation in place that would really make the difference in preventing the harm to children. So that's a challenge that still lies ahead of us and which we're working on very intensively.
And what type of legislation do you envisage would be necessary there, George?
Well, the biggest issue, quite simply, Jane, is funding. We have solutions. We know, we believe, what could produce the 70/30 result. We even in 2014 came up with a program that was backed by the Royal College of Midwives, the Institute of Health Visiting, senior managers in the directors, even in Public Health England and the Local Government Association, the chair of the Maternal Mental Health Alliance, director of the Association of Infant Mental Health, and many academics, all backed a particular plan that we put together for a comprehensive preventive approach to preventing maltreatment in their early years. In 2014, we spent 6 months talking about the plan to the HM Treasury, and at the end of that period, they decided to back the plan to be implemented in 4 English local authorities as pilot studies. Mm-hmm. They voted £15 million to test it in those 4 local areas in the 2014 autumn statement. In 2015, general election took place in England. The incoming government decided its #1 priority was cost cutting, and one of the easier costs to cut was £15 million that hadn't yet been spent at that point. Mm-hmm. So the money was taken away again. Since then, we've been working, developing ideas for implementing the program, trying to get funding with local authorities, but local authorities are very short of money. Many of them have gone through year after year of swinging budget cuts. Mm. So the biggest support national government could give would be to put some funding aside, even just to run some pilot studies of the solutions that we've got. And one solution we're particularly keen on, which has been implemented in Ireland, is a program, it's actually a Spanish program called PCPS, or Parent-Child Psychological Support. That has been running for 20 years in Spain, and for over 10 years it was running in Ireland, funded by Atlantic Philanthropies.
Okay.
Research in both Ireland and Spain showed that halved levels of insecure attachment and halved levels of disorganized attachment in children. It's a universal program, and if those results were replicated across the whole country, their impact would be absolutely stunning. Mm-hmm. And I would like to test that program on a larger scale. We have actually persuaded one English local authority to test it, which is the London Borough of Camden. Recently, 3 managers from Camden went out to Valencia in Spain to see the program in action, as I have been myself. Mm. They came back, and among their comments about the program were, "It's amazing. I was completely blown away by it. And this is a program that teaches parents to be the best possible parents they're able to be." Mm. So Camden is committed to implementing this. And in fact, would be implementing it this year if COVID hadn't got in the way.
Sure,
but
sure.
They are going to start implementing it next year. So there are solutions.
Yeah.
And we're working very hard, but funding is the big challenge.
That is quite exciting nonetheless. The one thing there, when you gave the numbers of the politicians who've signed up to this, while they're very impressive, part of me wonders why the rest of them haven't signed up in the various, jurisdictions, because who could possibly be against ending or at least reducing child maltreatment, by 70% by 2030? In terms of the adverse childhood experiences studies, which we've discussed before when I met you in Scotland, from my understanding, Wave Trust was kind of ahead of the curve, really, in relation to this science, long before it started becoming fashionable in Scotland generally, or in the UK and in Wales, and to a lesser extent now in Ireland. What was it about Vince Felitti and Robert Anda's 1998 findings that captured your imagination, George?
Well, as I mentioned earlier, we spent years, starting in 1996, when WAVE was founded, carrying out research into the root causes of child abuse, neglect, and violence. They're very much wrapped up with each other through intergenerational transmission, as I'm sure you know. I think it was 2007, or maybe in 2006, I was invited by the World Health Organization to make a presentation at a World Health Organization conference on the subject of the root causes of violent behavior. I made my presentation, and shortly afterwards, a later speaker at the same conference was Vincent Felitti.
Okay.
And Vincent Felitti was presenting the root causes of poor physical health and poor mental health. And he was saying exactly the same things that I'd said about the root causes of violent behavior. Mm-hmm. So Vincent and I sat down together afterwards and said how amazing it was. Here we were in two parallel worlds. At that point, neither of us had ever heard of each other. Mm-hmm. Yet we were coming up with exactly the same issues and exactly the same solutions. And I wasn't using the term ACEs or adverse childhood experiences at that time, but I was really just coming up with exactly the solutions that Vincent was coming up with. So I then learned the language of ACEs. Mm-hmm. I didn't need any convincing because we'd come to the same conclusions in WAVE. And I've been a supporter and advocate of ACEs, particularly the prevention of ACEs, the treatment of ACEs, the healing of ACEs, ever since that time.
Okay, George. And so you mentioned a bit about it there, really, in terms of the work of WAVE Trust and at the 70/30 campaign and some of your asks to policymakers. Is one of the major asks then really just to fund what the evidence shows is effective in preventing ACEs, or are there other things that you ask for as well?
Yes, I mean, firstly, if I sum up WAVE's 24 years of existence, it can be summed up in one word, which is prevention. Mm-hmm. Our grandmothers knew that prevention was better than cure. You know, we all know a stitch in time saves 9. An ounce of prevention is better than a pound of cure. This is age-old wisdom. Mm. We don't practice it in politics. And I was once in the office of, when Theresa May was Prime Minister, of one of the MPs who was a personal advisor to her. And he said to me, George, you know why you won't succeed, don't you? I guessed what he was going to say, but I said to him, go on and tell me why I won't succeed. He said, it's simple. We're elected for 5 years. Therefore, as MPs, we've got to produce results, actually in much less than 5 years, so that we can present the results of what we've done when we apply for re-election. You're talking about things that are over a much longer timescale. You're never going to get parliamentary backing for it. Well, he's wrong. We do have parliamentary backing for it. We don't yet have government backing for it. Although, in fact, and I'm not making a party political point here, because we have widespread backing from all political parties, mm-hmm. Sinn Féin, DUP, and SDLP, for example, for our policies. But the Labour Party had indicated that had they won the last election in the UK, they would have made tackling ACEs and supporting the 70/30 campaign part of their commitment. And it has in the past been written into the general election manifesto of the Liberal Democrat Party in the UK.
But not yet the Conservatives.
Not yet the Conservatives. Yet Ruth Davidson in Scotland was a strong supporter, and in fact, considerably more than half the MSPs of the Conservative Party in Scotland are supporters. We haven't yet reached 50% of Conservative supporters in the UK Parliament, but we have something like 20 ministers or ex-ministers, Conservative ministers or ex-Conservative ministers who are backing the 70/30 campaign. But we've still a bit of work there to do.
Okay.
To get Boris Johnson on board.
Yes.
But yes, to answer your question, it's not just about prevention. We also are very concerned about how you support people who've already suffered ACEs. Recently, in 2018, one of my colleagues produced a report called aged 2 to 18, systems to protect children from severe disadvantage. It was the result of a 4-year study into what causes children to fall into lives of homelessness, mental health problems, drug and alcohol addiction, persistent unemployment, and criminality. And key to her solutions was trauma-informed care, trauma-informed services, and supporting these people with the creation of trauma-informed communities. And WAVE started in 2017, again in Ireland actually, creating trauma-informed communities. And last year we were asked by the World Health Organization to join them along with the city of Oslo, so a tripartite original core, in creating trauma-informed cities and communities across the whole of Europe. Mm-hmm. And they asked us to take responsibility for the UK. And currently we have 12 areas signed up to be part of that trauma-informed community initiative in the United Kingdom.
Yeah, which is very impressive indeed. Are those communities kind of going to fund this model themselves, George, or they're going to take responsibility for bedding down this trauma-informed practice? Is it?
They are, because again, there is no government funding set aside for this. Mm-hmm. In any of the 4 nations. So at the moment, it has to be funded locally, and some of the local areas are putting more funding into it than others. But funding is, in all of these issues, mm-hmm. it's a challenge and a problem. Of course, everybody wants more funding for any subject under the sun. I'm well aware of it. But I think the arguments for prevention and healing the damage of ACEs has a very strong economic case backing it. And James Heckman, for example, the Nobel Prize-winning economist, has put the case for prevention from an economist's point of view very strongly and very succinctly, as have many other bodies, including Public Health England itself. But it's still not something that's really followed in practice. And even in the nations like Scotland and Wales, which have made a national commitment to it, they still largely leave the funding of it to local areas who are desperately short of money, constantly having to cut costs. And therefore, although it's easy to get local authorities to say they believe in it, it's actually quite difficult to get them to find the funding to go ahead with it in any meaningful way. I'm delighted Camden are an exception.
Yes, well done to Camden for having the foresight, because as you say, these aren't quick wins. For any government or any visionary leader, it's going to take time to show dividends and to demonstrate, I guess, that children, especially in tricky, deprived communities, are actually healthier, happier, safer, more secure, and that there's less attachment issues. You can't evidence it in 6 months or in 1 year, but the long-term benefits in terms of education, in terms of health, mental health, social behavior, less violence are massive for communities.
Indeed, and many of those are long-term or medium-term. But in fact, you can show results quite quickly, Jane.
Can you?
The PCPS program that I mentioned to you, it's a program that runs from 3 months to 18 months. It's a universal program. All parents are invited to go along to this program at 3, 6, 9, 12, 15, and 18 months of age. At 15 months, there is an assessment of the attachment style of the child. And at 18 months, the results of that are shared with the parent. And one can see already at 15 months that the program has had this impact of substantially reducing levels of insecure and disorganized attachment. Mm-hmm. Now, of course, to see that flow through into better behavior in preschool, disorganized attachment is typically followed by high levels of disruptive attachment behavior in preschool, fewer mental health problems, better behavior in school, better school outcomes. Yes, that will take longer. But the evidence is there of the pathways. We can see the pathways from insecure attachment to all of these outcomes, from disorganized attachment to these outcomes. So anyone who understands the pathway could tell within 18 months whether the program is working or not.
I suppose it's the lack of interest and the lack of policymaker focus in the 0 to 3s, really. They're not voters. And also, I think there's a disbelief that what happens to us in our first year of life can have actually massive consequences for our future health and ability to relate well to other people. This kind of almost people don't want to believe that it is true. And yet we know that it's true.
Only people who haven't looked at the research, because the research is quite overwhelming.
Yes, indeed, you're absolutely right there. And so, George, in terms then of this pandemic, where we have children, well, all of us are locked down in many countries, not everywhere, of course, but most countries have had periods of lockdown where we know child abuse and neglect are occurring, and domestic violence and addiction and mental health problems are probably spiraling due to the stress that people are under. Are you concerned for children who are in these situations right now and are cut off from the buffering effects of school and perhaps, you know, the attention of social workers or other adults who can, you know, look after their welfare and well-being?
Clearly, for at-risk children, it's a real concern. We've recently carried out a survey with frontline workers in police, health, social services and local authorities, asking them to fill in a questionnaire on the impact of COVID and lockdown on adverse childhood experiences and trauma. And pretty well everyone in fact, I think everyone who has replied has said, yes, there are increases. They've identified different areas of increase. Actually, the one that's come out as the most commonly identified impact is increase in mental health problems. Mm-hmm. But domestic violence, substance abuse, child abuse, you know, bereavement, worries about loss of employment or loss of career, all of these things have come out at very high levels of being identified by frontline workers to have increased. Mm-hmm. Child abuse has come out as being seen by fewer of the professionals, but they make the comment that that's probably because it's hidden, because they can't get into the houses in many cases. And if you come to somebody's door and they say, we're self-isolating, it's too dangerous to come in just now, well, that may be true or it may not be true, but there's nothing that they can do to, you know, to go into that house and find out the reality of what's taking place.
Sure. You and I are both interested, and you did one of your, I think your third study you mentioned on criminology. In terms of policymakers, you also mentioned engaging with the Violence Reduction Unit. Is it easier to generate interest in the well-being of children than it is to focus interest on the need for more responsive ways of engaging with adult trauma survivors, like those in our prison system, or people who engage in harmful, violent behaviour to others? Or have you found that policymakers are receptive to doing things differently with people who have not only been harmed as kids often, but have done harm unto other people?
I think in both Wales and Scotland, the national policymakers are very receptive to understanding that the people who are causing many of the greatest problems in society are also the most damaged people, and that what is appropriate is to support those people in an appropriate way while keeping society safe. Implementing that viewpoint has been slow and is a frustration, but I wouldn't expect to find very many people, and I talk cross-party with this. It's not just, you know, I'm not just saying this is true of the governing parties in Scotland and Wales. It's completely across the board from all parties that is recognised. And it's also recognised across the board in Northern Ireland in a very encouraging way. In England, it's a bit more mixed. Again, there's very strong cross-party support for the viewpoint that I'm just expressing, but there is a significant body of people who probably currently have the dominant influence on the UK Home Office and policies towards prisons and criminal offending, who really are still of the rather more old school, lock them up and punish them, and somehow that will change things. Mm-hmm. Even though as criminologists, Jane, you and I both know that that method has been proven over and over again not to work. Mm-hmm. But it makes people feel better.
Mm. And also, there's a bit of a disconnect with the fact that we know that child abuse and neglect harm children, that they are common, and that people with offending behaviour in their backgrounds often have these things in their history. So we might sympathise, even if we do nothing active to prevent it, from children being abused and neglected, but then we don't see them as victims any longer once they're in a prison setting or have done bad things to other people. So that there is that kind of failure to connect the dots, or willingness to follow through with the evidence again. George, I'd just like to turn now to some of the criticisms of the adverse childhood experiences evidence base that often come from social work people or people from the social studies background. And some of these arguments from, say, for example, White and Wastrel, are that we're biologizing social experiences, or that it's early years determinism, that what happens to you before you're 3 dictates your outcomes years later. And also that the original ACEs study leaves out crucial stressors like poverty, hunger, and housing. Do you think that these critiques of the ACEs evidence are valid, George?
I don't think they could be more invalid.
Okay.
I think they're absolutely and completely wrong and very, very badly informed by the people who have made them. There is a paper that has been used very much to put forward the arguments that you're describing. It's called The Problem with ACEs. Mm-hmm. And if anyone is listening to this, I've produced a rebuttal of that paper, which is called The Problem with ACEs. And it takes apart the very weak and invalid arguments that are used inside the Problem with ACEs document, and states why I think that they are that way. And let me say, I don't normally speak with this degree of strength in criticizing an academic viewpoint. As I've mentioned, I've been to 4 universities. I've been immersed in. I work all the time with academics. I have great respect for academics, but I think this is one area where I'm just horrified that people are setting themselves up as experts on a subject which they clearly don't know what they're talking about, in a way which I think, if anyone was paying serious attention to, happily, I think that they are not going to stop the flow of support for people who are taking ACEs seriously and taking action on them. As I say, the World Health Organization is working with us to do this across the whole of Europe now. But if anybody were stopping potentially beneficial work on ACEs because of their critique, I think that would be a crying shame.
But would you agree, though, that things like poverty, racism, being in a highly just stressed environment due to not having enough money and food in the house, that those are adversities too? Or do you think the original 10 ACEs cover the gamut of adversity that we need to explore in this regard?
The original 10 ACEs absolutely do not cover the whole gamut of adversity. There are many forms of adversity, and there are many forms of adverse childhood experience, such as bullying or the death of a parent, which are not included in the original 10 ACEs. The original 10 just focused on specifically controllable factors within a family environment. Death of a parent was seen as not controllable. But I think it's, firstly, let me take poverty, because that's the biggest thing that's put forward. I think that there is undoubtedly an impact of poverty on outcomes. As an economist, my interest was actually tackling poverty, particularly poverty in underdeveloped countries. It was where I specialized at university, was how to prevent the poverty of underdeveloped countries. And there are many things that can be done about that, and I would love those things to be done. However, in terms of poverty as a causal factor, it is nowhere near as potent as ACEs. And for example, Mark Bellis, who's carried out the English and Welsh ACE studies, has actually done studies from which I have been able to analyze the relative impacts of ACEs and the impacts of poverty on certain adverse social outcomes. I've got a list of them here, in fact, which include substance abuse, mental health problems, heavy drinking, daily smoking, and poor mental well-being. And the impact of ACEs is 7 times stronger than the impact of poverty on these outcomes. Not only that, but I think that there is a very strong case, and I'd be very happy to make the case in any scenario, that actually poverty is driven by ACEs.
Right.
James Heckman has produced a paper looking at the origins of poverty in the United States. And what he says is poverty is not caused by poverty. In other words, people are not poor because their parents were poor. People are poor because they have lacked the skills to become successful in life. In fact, we've got many, many examples in the United Kingdom of waves of immigration from people from East Africa, from many other countries who've moved into the UK, been at the very bottom of the social strata, extremely poor, but whose children have absolutely risen out of poverty because of a high focus on education, developing skills, and so on. Heckman has said it's lack of skills that cause poverty, and lack of skills are caused by the interaction or the absence of the correct interaction, the ideal interaction between parent and child in the first 3 years of a child's life. So the solutions to poverty don't lie in pouring money into the subject, they lie in changing the skill set of babies and young children, so they carry much better skills into school with themselves. And there are proven programs that can do that. And by the way, if answering poverty with the answer, I'd like to know, for example, why when we doubled or tripled national wealth in Britain between the 1950s and the early 2000s, levels of abuse didn't improve during that period, and levels of neglect may well have got worse. If solving poverty were the answer, seen from a 1950s perspective, we are fabulously rich today by the standards of that time, but it hasn't changed the social problems.
And of course, the other important thing that I always say is, while the concentration of adverse childhood experiences might well be higher, and in fact the CDC in its study last year did find in the States that there are more adverse childhood experiences in poor communities and communities of color, you know, that African Americans and Native Americans were and females were more likely to have 4+ ACEs. But the original study was done with mainly white, middle-class, college-educated people with health insurance, and the adverse childhood experiences were very common. So clearly poverty was not an issue there. So to kind of delude ourselves that if we eradicated poverty tomorrow, adverse childhood experiences would go away, they'd mysteriously vanish, is not correct, I think.
And more to the point, if we eliminated poverty or made a massive reduction in poverty, problems like drug addiction, alcoholism, mental health problems, etc., violence would also not go away. Because while I'm not denying that poverty has an impact. I'm not denying it. I think it has a much smaller impact than ACEs does. And I think there's an interactive effect between the two of them, in which ACEs is much more of the driver of poverty than poverty is of ACEs. Would you like me to say a bit more about the social science critique of ACEs, or do you think we've done enough on that?
Well, we might well have exhausted it. It is an important one because it keeps coming up, I think, as a critique. And also, where do you stand on screening for adverse childhood experiences, George? Do you think it's a good idea, or is it risky, or is it a way of getting things that are taboo out into the open, so that parents can learn that if they don't address their own histories, that they can unwittingly and unintentionally pass their adversities on to their children?
Well, I'll tell you a funny thing. We work a lot with people who were traumatized in childhood, and we run an all-party parliamentary group for prevention of ACEs in the UK Parliament, and a cross-party group for the prevention and healing of ACEs in the Scottish Parliament. And we get people with ACEs coming along and speaking at those. Almost without exception, and I actually can't think of an exception, people have told us that they welcome and are delighted when people actually measure and are able to talk openly about ACEs. Whereas it's used as a criticism of ACEs, that we might somehow pathologize people and lead them to be more likely to lead negative lives. The people who've suffered ACEs have completely the opposite opinion. They welcome bringing it out into the open, making it a topic that people actually talk about, because their problem is it's been swept under the carpet for so long and nobody has talked about it. Having said that, I think it's a question of looking at specific circumstances. For example, I worked in prison with men with ACEs. I identified their ACEs, and I healed the impact of their ACEs through trauma treatments that I had learned to administer. And the end result was that violent men stopped being violent, including in prison. Some of them were very violent in prison before I worked with them. They completely stopped violence. I never once administered an ACE survey to any of them. I simply found out their history and what had gone on in their history. I didn't need an ACE survey to do that. I think there are many different ways of understanding what's brought someone to where they are. But at the same time, in Wales, there have been experiments done in Anglesey where GPs and health visitors have administered ACE surveys to the families that they're working with, and the families have welcomed it. Well over 80% of the families said it was something quite positive that they were asked these questions. They didn't object to them. They were all given the chance not to answer them if they didn't want to. And the conclusion of Public Health Wales was that actually this was something that was safe to do, and far from producing negative reactions, it produced positive reactions.
Okay. I'll just ask you one final question, George. In terms of influencing policy and policy makers, do you think there's more that individuals can do? You know, whether they work as a child psychologist or a teacher, or are parents themselves or survivors of ACEs, do you think that there's power in the collective voice, for example, through the 70-30 campaign, in actually using the voice that we have and writing to our political representatives and saying, please get on board with this, you know, ask questions, let's try and mobilize some action to prevent child abuse and neglect?
There's no doubt that campaigns can be very effective, and the world is full of campaigns of one form or another that have been effective, and campaigns which, however noble their cause, like preventing us from destroying the environment of the planet over the next 50 years, haven't yet really succeeded, though for all our sakes, I hope that they do sooner rather than later. But one of the most powerful ways of influencing politicians is just for people to write to their own TD or MP or assembly member or MSP or whoever it may be, and just expressing a viewpoint. And we found MPs, elected representatives, they care most of all about the people who vote.
Yes.
And people who will vote at the next election, either to support them or not to support them. And when a significant number of those begin to write about a subject, then there's no doubt that makes a difference. And that's one of the things we have sought to do with our 70/30 campaign, is to encourage our ambassadors to contact their local MPs. And some of our ambassadors have not only enrolled their MPs in backing 70/30, but we've got parliamentary speeches, impassioned parliamentary speeches made by MPs in favour of the work of 70/30 or prevention of child maltreatment, where they've actually mentioned their ambassador, their local constituent ambassador, as the person who's really triggered them to stand up and make a speech on this particular topic. So yes, there are many ways to make a difference,
yes.
But that is one of the strongest.
Yeah, so people need to get writing to Boris Johnson and the other ministers, and depending on the jurisdiction that they're in, try and gain backing, and to keep the momentum up as well, because there's always a new disaster. There was Brexit for several years, now there's COVID-19. There'll be something else down the road that can consume energies and everything else falls off the radar. But of course, this is an enduring issue that has lifelong potential negative impacts for people, and makes the rest of society less safe as well, I suppose, in many ways. So,
and potentially, Jane, there could be a role for the media in that, because if there's one thing politicians react to, it's the headlines in the daily newspaper.
mm-hmm.
I've worked with hundreds of MPs over the last 10 years or so. The thing that they care about most, especially if they're in government, is what tomorrow's headline is going to be, or what this morning's headline was. As long as newspapers focus on the dramatic and the short term,
mm-hmm.
and the latest fire that has to be put out by MPs, that's what MPs will most respond to. If we could get some parts of the media really willing to put their campaigning support behind, because we can transform childhood. There's a report we produced, won't go down well in Ireland, but it was called Building Great Britons. It could just as well have been called Building Great Irish Men and Irish Women.
Sure.
Content would have been the same. It actually lays out, it's a parliamentary report, it lays out exactly a blueprint for transforming the whole future of a country. Not just children, the whole future of the country. It's laid out there in a blueprint, but it requires people in the media to start making that something that politicians are thinking about when they pick up their newspapers.
We'll leave it there, George Hosking. Thank you so much for taking the time. George Hosking, OBE CEO of Wave Trust. I'm a great admirer of your work and the energy of your organization and the 70/30 campaign. So thanks so much for agreeing to talk to me today about how to talk policy and influence people, and best of luck with all your endeavors going forward.
Thanks, Jane. I'm a great admirer of the work that you're doing, and you keep up your great work as well. Thank you.
Thanks so much.
Bye.
Bye. There we go. There.